Okay, good afternoon, Dr. John here, Bernardo W. Spine Clinic. Welcome. Today's session, we're going to be doing what's called a flexion distraction technique. It's really important because it helps to pump the disc that's herniated back into its original position. It aids in other chiropractic techniques as well. So what we do is we set the patient up. We first distract the patient accordingly to the patient's weight. Once the distraction is completed, then what I do is I palpate the area. In this case, it's going to be L5-S1. So I go to the SI joints and I go up one, and this is the L5-S1 disc. Okay? And I look to see where the spinous process is. So the spinous process in this case is on the left-hand side. So left spinous listing L5 on this patient. What I do then is I go ahead and close the wedge. So if it's a spinous on the left, the wedge is going to be open on the right-hand side. So what I do is I traction, close the wedge, and I straighten out my fingers towards the skull of the patient. So in other words, we'll start again. I start with my middle finger towards the opposite shoulder, and then I rotate clockwise, in this case, till my fingers are facing the patient's head. Now the wedge is closed. Once I do that, I traction slightly superiorly and anteriorly. So in other words, at a 45-degree angle. Once I feel that pressure and it's just right, it's set now, I ask my assistant to start the process. We're going to go 10 times. Flexion distraction, 10, go. So the table goes down, up, and in doing this, it pumps the disc back into place, and it also aids in stretching out the important fascia that's a little too tight and guarding the patient. So it's a twofold process. We do this 10 times, and this technique is definitely important for any type of disc herniation that you may be experiencing, especially a moderate disc herniation. Okay, we're going to go 4 more times. Time. Okay, now we've completed the session. Now what happens is we take the patient back to her original position. So as the table becomes to its normal position, then once it's completed, then we ask the patient to come off the table.